Hey guys, Tony here. So in this Medicare Minute tutorial, I want to talk about reevaluation. I think reevaluation is probably one of the most misunderstood terms in the Medicare lexicon. So behind me on the screen, you guys can't see it, but I'm using CMS Chapter 15, the Medicare Benefit Policy Manual, specifically page 158. We're looking at the definition of reevaluation. And I want you to just think about that. A reevaluation is not a reassessment. A reevaluation is not a progress report. It is you doing an evaluation again. Think of what you did for the initial evaluation, and you're redoing an evaluation. So let me read the definition and then we'll talk about it. A reevaluation provides additional objective information not included in the other documentation. Reevaluation is a separately payable event and is periodically indicated during an episode of care when the professional assessment of the clinician indicates a significant improvement, or decline, or change in the patient's condition or functional status. Now, most therapists stop reading right there and they think, oh, a change. Okay, I'm going to do a reevaluation. But the sentence goes on to say, clinician's status that was not anticipated in the plan of care. Not anticipated is massively important for us to keep in mind. You know, we anticipate decline. We anticipate plateaus. We anticipate improvement. What is not anticipated? When something is not anticipated, when it's legitimately surprising, that is when we do a reevaluation. Let me finish reading the next two sentences and then I'll explain. So it says, quote, although some state regulations and state practice acts require reevaluations at specific times, for Medicare payment, reevaluations must also meet the Medicare coverage guidelines. The decision to provide a reevaluation shall be made by a clinician. Okay, so my kind of general rule of thumb, I hear a lot of therapists in private practice say, well, I was treating a patient, the patient was admitted to the hospital for a UTI, they were discharged 3 days later, I need to do a reevaluation. I don't believe that's the case. I understand they were hospitalized, I understand they were admitted, but that really didn't necessarily change what you were originally treating as an outpatient therapist. So if I'm treating a patient for hip pain, they get admitted for a UTI, they get discharged 3 days later with some antibiotics, the hip really is unchanged. There's nothing unanticipated that's going on. It's not a home health case where they were hospitalized and you need to open the Oasis and do all that stuff. I'm totally ignorant to home health. It's outpatient therapy, Medicare Part B. So in a case like that, I would do a progress report perhaps. I'd communicate with the physician perhaps about what's going on, but there's really no material change or nothing that's happened related to the condition I was treating. Now, conversely, if I'm treating a patient for hip pain, I'm assuming it's osteoarthritis. Turns out the patient actually had a hip fracture. Now they get hospitalized for imaging, for pain. They come back. Their functional decline is evident. I was not anticipating a hip fracture, a femur fracture. I was anticipating osteoporosis, osteoarthritis. In a case like this, yes, I am going to do a reevaluation if I'm still treating the same condition. The other confusion, I think, is around different conditions. So if I'm treating a patient for hip pain, then 3 weeks later, they're diagnosed with low back pain, that's not a reevaluation. I'm not reevaluating the hip. I'm not evaluating the hip again. Now I'm evaluating the low back. It's a new condition. It could be related, but it is a completely new and separate condition. Now, in my last video, I talked about an episode of care and I talked about Medicare guidelines on when you're treating a condition and then a new condition arises, you can do a second evaluation that is a separately billable event. I talk about combining the plans of care, keeping them separate. There's different ways you can approach it. But the idea is that if it's a different diagnosis, it is not a reevaluation. It's a new evaluation. So guys, I hope that helps to clear up the terminology. go to page 158 on the CMS Chapter 15 Medicare Benefit Policy Manual, and you will find the exact wording. You really want to have these references in your back pocket so that when somebody questions your decision, this is what you base your decision on. If you haven't subscribed to the channel, please go ahead and do that, and I'll catch you on the next Medicare Minute.